Diabetes, high blood pressure, high cholesterol and heart disease can be treated individually with multiple medical treatments. But there is one way that can manage all these conditions together, and that is through weight management. A non-invasive way is to use the intragastric balloon. The procedure involves inserting a deflated silicone-based balloon through the mouth, down the throat and into the stomach, and once it's there, we will inflate it. Once a balloon is inflated in the stomach, it occupies space. It is recommended that the balloon stays in place inside the stomach for about 6 to 12 months, and therefore every single time you consume food, that restricts the amount of food that you can eat. This procedure is usually recommended for people who are overweight or a body mass index above 27. It can also be performed for people who are not suitable for major surgery. This procedure involves a band that is placed around the top part of the stomach with an inflatable balloon lining the inside of the band. The other end of the tubing is placed underneath the skin, and with injectable fluid, the band can be filled up and deflated. By filling up the band, the restriction to food is greater. The gastric bypass is a procedure that can be done with minimally invasive surgery or laparoscopic surgery. In this procedure, the stomach is made into a small pouch, and subsequently the small intestine is divided and joined to this pouch. The food that you consume goes into the small pouch of stomach and is diverted into the small intestine. Therefore, the amount of food that is absorbed is much less, and reducing the amount of calories that is absorbed. The sleeve gastrectomy is the most common bariatric procedure that is done in Singapore today. A portion of the stomach is divided from the rest of the bowel and removed. This procedure makes your stomach look like a sleeve, and therefore you can only eat small quantities of food at each time. My team and partners are here to guide you through your weight management journey together.